Glad to be with you once again for my weekly webcast. I put on Twitter invitations for you to send in your questions. I thank you very much for doing that. This is a way to make the process of representative government wants to work. I can speak to a lot of issues, I can listen to a lot of different people, but if we can have this sort of two-way conversation where you ask me specific questions, it makes it a lot easier to address the things that I know people are really interested in. So let's immediately go to the questions that have come in. And those that have come in that I don't refer to right now will be answered in writing, so I thank you for those questions as well. The first question comes from Sonia, Riverdale, emails, quote, in regard to health care, why can't Congress pass the stuff that most people agree on rather than focusing on a few issues that divide us? I think that's a very, very important question because of a 1,000-page bill, there's a lot of it in the area of what we call delivery system that are relatively non-controversial and something we ought to do. And I will mention just a few of those. One would be preventive medicine. It's cheaper to keep people well instead of waiting until they get sick to get them well. So incentives for people practicing quality life, life of exercise, eating right, as well as making sure you get preventive medicine tests and things of that nature. Another one is concentrating on people when they leave the hospital with follow-up care, because 20% of the people that leave the hospital are back in the hospital in 30 days, and incentivizing doctors and hospitals to do it right the first time would save a lot of money. And another area where we spend 75% of our health care dollars on 5 maladies, diseases, some of them very complicated. These are called chronic diseases, let's say like diabetes as an example. If we could concentrate on those, it would save a great deal of money. And we would do that by setting up coordinated care organizations, as an example, where doctors and healthcare people practice in a team, specifically monitoring people with chronic diseases to a greater extent. Now, all of these things I mentioned have been done in individual companies, have been done through healthcare organizations in other parts of the country, pretty effective demonstration projects that have worked and have saved a great deal of money. But now, Sonia, you asked, why can't we just do that? Well, there's people around here want to do things up big time. So that's why they want to use these things that there's general agreement on to get a lot of things done that are not, that are much more controversial. And I'll just name one of several. But individual mandate. You know, that's a mandate that says you and everybody else has to buy health insurance, and if you don't buy health insurance, you're going to have to pay $750 as an individual, $1,500 as a family to the IRS in the form of higher taxes if you don't do it. Well, never before in the history of our country has the federal government ever said you have to buy this or that. And so for the first time, they would be saying that. That's very, very controversial. So consequently, people want to use these non-controversial things to get through things that are controversial. Next question comes from Twitter, Keegan from Urbandale. Have you received any feedback from your criticism of the Time magazine article that vilifies the family farm? Yes, I have, Keegan, and it is all very, very positive, and I'm going to look now what I can follow up to educate people more about the family farm, and particularly to point out very strong shortcomings in the propaganda that's in an article like was in Time magazine, because I think we have to educate the family farm to the American people. Now, I thank Sonia and Keegan for your questions. I move on now to when I tell you what's going on this week in the United States Senate. We're going to continue consideration of the Commerce, Justice, and State Department appropriation bill, one of about 13 appropriation bills we do each summer and fall to finance federal government for the next fiscal year. We'll be on that most of this week, I believe, because Senator Reid has announced that there will not be votes on Friday, so we'll probably get out of here by midnight Thursday night would be my guess. In addition to what's on the floor of the United States Senate, remember that this is the week that we finally vote out the Finance Committee bill on health care reform, the health care reform that we just talked about in the case of Sonia's question. So I invite you back next week to my webcast. Please send in your questions by Facebook, Twitter, or email. Thank you all very much.